If you or a loved one are expected to have Mohs surgery, you might be a bit nervous or not know what to expect. I'm about to show you what we do here in our Mohs clinic. So skin cancer is the most common cancer, and it typically affects people as they get older.
My body knows I'm nervous. I didn't think I was, but then I woke up at 3 in the morning and couldn't get back to sleep. Everybody assures me that it's 99.9 or something % success. I think Rush is an excellent hospital. I used to work here. So I've seen what goes on behind the scenes. I still come as a patient.
Good morning. Hi, Tim. How are you? One thing that people say that surprises them is how quick the actual Mohs surgery procedure is. The goal is to remove all the cancer cells in the same day and you leave cancer-free. We start off by positioning you on the table. We're just gonna clean you off and numb you up to start, okay? It's going to feel like a poke in the burn. The numbing doesn't take away all of the complete sensations, but it does take away pain and out. That was the hard part. And then we begin the procedure. Not too far from being done here. Still doing okay? You might smell a little bit of like a stinky, smoky smell, and that's because we're heat sealing or kind of burning the little tiny blood vessels within the skin so that they kind of seal off and so that you don't have bleeding after your surgery and while you're waiting. But we'll send that off to be tested, and then when we're done with that, Jill's gonna bandage you up, and that's when we wait. We typically take all of the layers of the skin and we test it under the microscope. That's the part that takes a bit of time. Bring a book. Nick processes the tissue so that I can look at it.
The first thing I'll do is I'll ink margins around, that way you can tell where exactly in the tissue you're looking at. And we'll put it into this machine over here that is a freezing chamber, -30°C, and we'll take very thin slices of it. This machine can cut slices of skin thinner than paper, like a very fancy deli slicer, and then we'll stain them. That way when you see it under the microscope, you can see if there's still cancer in there or not. Like, the most important thing to me is the quality of my slides, because if it were me personally getting this procedure done, I would want the doctor to see every single cell.
I look at it under the microscope and look for any cancer cells. This piece does still have a little bit of basal cells still left, so we will have to take a little bit more. If anything's left, then we come back, we give you some more numbing medicine, and we take from the areas that show that there's still cancer cells left. And still doing all right, no pain, right? Not too far from being done here. Cautery one more time, okay? Once we confirm that all the cancer has been removed, then we can close up the wound. We typically put stitches in. The healing phase is usually about a week or 2, and typically we recommend that people take it a bit easy during that time. So after Mohs surgery, you do trade that little skin cancer for a scar, but with Mohs surgery, the whole point is to try to keep it as small as possible. The scar can be a little bit pink and lumpy bumpy, or a little bit more noticeable in the beginning phases. And we purposely make the scar a little bit elevated so that as it's healing, it flattens nicely versus forming a divot. But typically after about 6 months, the scar tends to fade. Not 100%, but to the point of it being as minimal as possible. How do you feel about it?
I'm very glad it's over.